Today, we'll be discussing COVID 19 since this is one of the most controversial topics nowadays. Different videos are spreading, and it is sad to know that these videos often spread wrong information, leaving the viewers misinformed about the issue. We'll be having a recap on what COVID 19 is. We'll also be discussing what are the different rapid tests available to determine whether you are infected with the virus or not. What are the details regarding results, and what is to be expected from this. We'll also be briefly delving on the vaccine issue in this video, but if you need a detailed explanation on vaccines, another video was prepared for your reference. What is SARS-CoV-2? Severe Acute Respiratory Syndrome Coronavirus 2, Coronavirus Disease 2019, or COVID-19 is a contagious disease caused by coronavirus which was first identified in Wuhan, China last December 2019. The disease has since spread worldwide, leading to an ongoing pandemic. The symptoms vary from mild to severe, and these include headache, loss of smell and taste, nasal congestion and runny nose, cough, muscle pain, sore throat, fever, diarrhea, and breathing difficulties. Patients with these symptoms are tested to confirm whether they are infected or not. But it is also possible to have the virus while the symptoms are absent in an individual. Just in case, one wants to know if he or she is infected while being asymptomatic. Is there a way to know? Let's move on to the rapid test. There are different types of tests conducted for COVID-19, but we'll be focusing on the rapid ones. What are these rapid tests? Rapid test refers to medical diagnostic tests that are easy and quick to perform. They allow point-of-care testing or testing done outside the laboratory and provide same-day result within 2 hours or possibly less. Rapid tests are divided into two: antigen testing and antibody testing. Antigen testing is used to detect protein fragments of the actual virus which may be present in one's body. This is used to determine whether a person is currently infected with the virus or if the virus isn't in the system anymore. Antigen testing is usually recommended for symptomatic patients and for people with close contact with COVID-19 patients, regardless if they are asymptomatic. But if one wants to get tested, even without symptoms or without close contact with COVID-19 patients, it is also possible. In terms of accuracy, antigen tests correctly ruled out infection in 99.5% of people with symptoms and 98.9% of people without symptoms. Though, these numbers vary depending on the brand used during testing. That's why it is necessary to get tested in accredited clinics. Next is the antibody testing. This testing is used to detect antibodies or immune cells the body has produced against COVID-19. These antibodies are either produced after a natural exposure with the virus or after a successful vaccination. If you want to know more about antibodies, kindly refer to my other video about the immune system. As an essential reminder, remember that these tests look easy to perform, but it is necessary to ask a medical professional to conduct the testing and to explain the results to avoid inaccuracies due to mishandling of specimens, errors in the procedures, and misinformation. Okay, you got tested. What are the possible results one can expect after having the test discussed a while ago? Before we proceed, remember that test results are correlated with other findings before a diagnosis is made. It is better to consult a doctor than to self-diagnose with the data you get from the internet. Moving forward, this is an example of a test result from an antigen testing. It indicates the source of the sample, either nasopharyngeal swab or throat swab, the brand of the test kit used together with its lot number, and the test result itself. Antigen tests will yield of positive or negative results. A negative antigen test means that possibly the patient doesn't have the virus at that given time or the amount of virus present in the body isn't sufficient for it to be detected. A positive antigen test On the other hand, means that the patient is possibly harboring the virus during the time of testing. This is the reason why test results are correlated with physical examinations by doctors. There are guidelines and protocols in determining whether one is infected, possibly infected, or not infected at all in using antigen tests. This is to guide you on the steps your healthcare provider might ask you to perform once your results are released. When testing a person with symptoms associated with COVID-19, the healthcare provider generally can interpret a positive When testing a person with symptoms associated with COVID-19, the healthcare provider generally can interpret a positive antigen test to indicate that the person is infected with the virus. A negative antigen test result for a symptomatic person should be confirmed with the nucleic acid amplification test or NAAT. When a symptomatic person gets a negative antigen test result followed by a negative confirmatory test, the healthcare provider will take into consideration whether the person has had exposure to a person with COVID-19 within the past 14 days. If the person has had exposure, that person should follow infection control measures for 14 days after their most recent exposure to a person with COVID-19. In our country, the NAAT that we use is called RT-PCR or reverse transcription polymerase chain reaction. When testing a person who has no symptoms and has had exposure to a person with COVID-19 within the last 14 days, the healthcare provider should confirm a positive antigen test result with a confirmatory test. The healthcare provider should direct the person who receives a negative antigen test result or a negative confirmatory result to quarantine for 14 days after the last known exposure to a person with COVID-19. Clinical judgment should determine if and when additional testing is necessary. When testing a person who is asymptomatic and has not had known exposure to a person with COVID-19 within the last 14 days, the healthcare provider generally can interpret a negative antigen test to indicate that the person is not infected with SARS-CoV-2. As discussed previously, one must get an RT-PCR after testing positive in an antigen test, but the recent DOH protocol states that a positive antigen test is sufficient to declare that one is infected with the virus and a confirmatory test is not anymore necessary. This is, on the other hand, an example of antibody test result. Antibody tests will yield off positive or negative results on either IgM, IgG, or both. Negative results on both means that possibly the patient has no infection or there is not enough detectable antibodies present during early infection. Positive results mean differently based on what turned positive. IgM positive results could mean recent infection, and IgG positive results could mean previous infection with COVID-19 or a successful vaccine inoculation. Another reminder, these results are medically correlated by healthcare providers, so do not interpret on your own, especially if you do not have a medical background. For our last topic, we'll be discussing vaccines for COVID-19 since this is considered the most debatable topic regarding this pandemic. Is it really beneficial to get vaccinated? For us to be able to answer that question, we'll be discussing several questions relating to vaccines in a COVID-19 perspective. How do vaccines prevent COVID-19? Having the vaccine is just like having the actual virus inside one's body, but only safer. Instead of having the disease-causing virus which produces different effects inside the body, vaccines mimic the virus and triggers the body's creation of antibodies. These antibodies, which are ready for combat anytime, will provide protection once a person is infected with COVID-19. How do vaccines differ from each other? Vaccines differ in their composition and how they trigger the immune response to create antibodies. Vaccines can be inactivated, weakened, or killed copies of the whole or part of the virus or genetic product that creates protein copies without causing disease. Again, without causing disease. What are the possible side effects of vaccination? The possible side effects of a vaccine include pain, redness, itchiness or swelling at the injection site which may last a few hours, fever, feeling of weakness or fatigue, headache, dizziness, diarrhea, or nausea. If one experiences any of this, it is recommended to consult the nearest healthcare professional. What COVID-19 vaccine brand must I get? The best COVID-19 vaccine is the first one that is available to you. Do not wait for a specific brand. All currently authorized and recommended COVID-19 vaccines are safe, effective, and reduce your risk of severe illness. Are there risks for complications when given the COVID-19 vaccine? The honest answer is yes. Like other vaccines such as for measles, mumps, and chickenpox, there are risks of complications, but severe or life-threatening reactions are extremely rare. The benefit of protection against severe COVID-19 is greater than the risk. Anyone who will get the vaccine will be properly evaluated and closely monitored by healthcare professionals to further minimize risk. So that is the end of this presentation. I hope you guys learned something. And before I go, just a simple reminder. Kindly choose what to believe on the things you see on the internet. Not all of those are accurate and are safe to believe in. Safety comes with the right knowledge, so if you have questions, kindly ask healthcare practitioners instead of asking the internet for answers. With this, I hope you had a great time. Stay safe, guys. Goodbye.